Summer's winding down. The Minnesota State Fair is well underway. Kids are going back to school or getting ready to go back to school. Congress will head home from their summer recess soon, and the President is back in Washington after his summer vacation. He's back on the campaign trail, getting ready for the battle with Congress over ObamaCare, what they call the Affordable Care Act. Now, it's kind of interesting. We're being set up for a number of things. The media has had very little to cover for the past few months because the President declared that all of the controversies surrounding his administration are phony controversies. The media, who still gets a tingle up its leg every time President Obama speaks, have chosen to accept that explanation and refuse to look into these controversies. ObamaCare, which over 50% of us do not want to take effect, is one of those issues that is a phony controversy. Even though I'm not a big fan of polls in general, however, understand that the media that is taking these polls is all in favor of Obamacare. So when their polls show that over 50% of us don't want it, maybe somebody should start to listen. Now, President Obama comes back, jumps right on the campaign trail, and starts attacking the Republicans because they won't participate in funding Obamacare. He comes out and he accuses the Republicans, says that they're interested in the poor and middle class not having health care. Well, that's a ridiculous position to take. Nobody believes that the Republicans or the Democrats are not concerned about their fellow Americans. However, the media will listen to what President Obama says. They'll cover what President Obama says. And so they'll jump on the bandwagon with Republicans just don't care about the rest of the people. Now, why do 50% or over 50% of Americans not want Obamacare? Because over 50% of the people in America realize that Obamacare will do nothing to improve the care or the health care for most American people. Nor will it do anything about making health care more affordable for the American people. Nothing in the law does that. You'll recall, if we go back several years, when Nancy Pelosi made her famous statement, "We have to pass the bill so you can see what's in it." Even though President Obama and the Democrats controlled both houses of Congress and promised that they would not vote on legislation until it had been published where the American people could read it and respond to them. This bill was so important that they really didn't even have time to type it out or print it out. Many of the provisions of this bill were handwritten in the margins when it was voted on. None of your legislative representatives in either the House or the Senate read the bill before they voted for it. Now, you could defend the people who voted against it without reading the whole bill because they may have read enough to see there were provisions in there that were a disaster. But how anybody could vote for this bill before they read it is beyond me. By the way, that would apply to any other bill. This bill is around 2,000 pages long. It now has regulations that accompany the actual bill of almost 20,000 pages. Why was it so important that we have the Affordable Care Act passed by Congress? Well, you'll recall that one of the arguments was that there were 30 million Americans who didn't have health insurance. Now, they never bothered to look at why they didn't have health insurance. They only looked at the fact that 30 million people didn't have health insurance. And they said if we require them to have health insurance, and if we require the health insurance companies to provide them with health insurance, then that will eliminate the 30 million uninsured people. Well, we hear a lot in the media anytime one of the politicians wants to prove their point. The bipartisan Congressional Budget Office did a study. Well, the bipartisan Congressional Budget Office has done a study on Obamacare. 30 million people uninsured prior to Obamacare. Post-Obamacare taking full effect, the bipartisan Congressional Budget Office has said that there will be 30 million uninsured Americans. I thought this bill was supposed to eliminate that problem. Guess not. The other thing this bill was supposed to do is reduce health care costs for all of us. And understand, first of all, this bill does nothing for health care. It only addresses health insurance. But it was supposed to make health insurance more affordable for all of us. Yet most Americans have already seen a dramatic increase in their health insurance premiums. Now, President Obama has gone to some pockets and said, oh, this family's already received a rebate from their health insurance provider of $130 or whatever the amount was. Well, he can maybe find a couple of small pockets, but almost all of the rest of us have seen increases in our premium, not rebates. The provisions in it increase health insurance costs. Waiver of pre-existing conditions increases costs. Insuring uninsurable increases costs. Forcing parents to keep their children on their health insurance plan until they're 26 years old increases health insurance costs. I'm not even saying whether these are good or bad provisions, but they're not going to reduce costs, they're going to increase costs. So maybe we should first analyze why people are not insured and see, is this law or any other law that's passed going to change that, going to have an impact on that? Now, furthermore, how did the bill even pass through Congress? You'll recall that special deals had been made to get your elected representatives to vote for it. Some would just blindly follow because it was their party that said they wanted it. There were some other more independent thinkers within the Democrat Party that said, not so fast. I'm not going to support this bill. Well, what did they do? They exempted Louisiana and Nebraska, as an example, from certain provisions of the bill that impacted the state's budgets. Interesting, isn't it? If this was such a good plan, why did they have to make special provisions to get votes for the plan? Oh, by the way, in most areas of our lives, that would be called a bribe. In Congress, they call it, well, I don't know what they call it, but I still call it a bribe. If it's so good, why do they need that? By the way, since the bill passed, President Obama has been extending exemptions to certain groups and companies and union groups to allow them to either not participate or extend the length of time before they have to participate. Congress itself, by the way, exempted themselves and their staffs from the provisions of Obamacare. If it's so good for you and me, then why wouldn't it be good for them? Something to think about, isn't it? Now, more recently, President Obama extended the time employers have to participate in the required coverages. Now, why is that? Well, they said that they haven't had time to implement the system to monitor this. Well, gee, why not? And is it any coincidence that the extension goes till after the election next year? Maybe that's why they're being extended. The unions who pushed for Obamacare and supported Obamacare thought, yes, we got to get this through, now have all of a sudden gone against it because they realized a couple of things. One is it will cost jobs, not create jobs. The other one gets very interesting because Obamacare attacked and taxed what is called Cadillac plans. These are very rich health insurance plans that most of us probably don't have through our employers. The union didn't realize when Congress defined these things that they were defining union health insurance plans. Oops. Maybe we shouldn't be taxing those. Oh, by the way, you'll also recall that when they passed it, they said there are no taxes to this. There are some penalties if you don't participate. When the requirement was challenged in the Supreme Court, however, the government argued that these penalties were not in fact penalties forcing people to buy a product, but they were taxes. And since Congress has the right to tax, therefore it's okay. And by the way, that was the government's argument, is it was taxation. That was the Supreme Court's creation in their ruling to call it a tax, which it had never been called before. By the way, there were taxes in it. The medical device tax, which again raises the costs of health insurance, because who pays for the medical devices? And by the way, who pays for those taxes? Well, that'll increase your health insurance costs. Or, by the way, if you don't have health insurance costs, it will increase your cost for medical devices. Need a pacemaker? Extra tax. Need a wheelchair? Extra tax. Isn't that interesting? Yet they were telling us there were no tax increases. There were a number of tax increases in this bill, most of which the American people are vehemently opposed to. Most people in the American public are very happy with their health insurance that they've had for years and with the doctors they've had for years. By the way, if this is implemented, it will, in fact, the government's done nothing to increase the number of doctors and other medical providers to help you get the medical services that you need and want, and now that somebody else is going to pay for them, will use. Now, I'm not saying all of the provisions in the bill are bad. I'm saying the law is, in fact, bad. We could have fixed a lot of the problems that in many cases we didn't fix with different legislation. There are many states, like the state of Minnesota, where there is not one person in the state of Minnesota that has been uninsurable in the last I don't know how many years, because Minnesota had a provision that said if any health insurance company has declined you for coverage, you can go into a state plan, much like states provide for auto insurance, by the way. So many states weren't even helped by the uninsurable issue. Lots of uninsurable people still don't buy health insurance. Lots of insurable people don't. Many of the 30 million people are young people that feel it's not worth the premium. They'll take the risk because they're invincible. To a large degree, they're right. They are invincible. They probably ought to be carrying a $5,000 or $10,000 deductible plan so that if they have a major catastrophic health event, they do have most of the money to pay for it, and they only have to come up with that $5,000 to $10,000 deductible plan. By the way, many of you say, yeah, but who can afford a $5,000 or $10,000 deductible plan? The people who aren't carrying insurance can afford that much more than they can afford the $1 million claim. They're not buying insurance now, and under ObamaCare and the Affordable Care Act, which supposedly requires it, they're still not going to buy it. That's why 30 million people will still be underinsured. Now, in the last election, actually two elections ago, the midterm election, the Republicans took control of the House of Representatives. Why? Because most people were upset about this Obamacare legislation that came through and voted a lot of Republicans into the House of Representatives. In the election coming up next year, the Republicans can probably maintain their majority in this House and can probably even obtain a majority in the Senate unless they do stupid stuff like they did last time around and put up candidates who make statements like, well, gosh, if a woman's raped, she won't actually become pregnant. Where he came up with that one, I don't know. And does he represent most Republicans in that statement? No, he doesn't. How they ever nominated that guy is beyond me. And by the way, that was a seat that was considered a pretty clear win for the Republicans until he made that stupid statement. Now, the House of Representatives, controlled by the Republicans, has voted 40 times to repeal Obamacare. Bold move? Probably not. That's what they were elected to do. Additionally, everybody knew that the Senate wouldn't even vote on it because Harry Reid's scared to death that if he brings it to a vote on the Senate floor, enough Democrats will vote to repeal it that they'll lose Obamacare. But they really don't need to worry about that either because President Obama would never sign it into law. Now, here's the deal. We're hearing a lot in the media now about defunding Obamacare. The title of our talk today is Defund or Defend. Okay? We're going to talk about defunding Obamacare. You're going to have to tell me the defense of Obamacare because I can't come up with the defense of it. So what I'd like you to do, if you defend Obamacare, is send us an email. Tell us which provisions of Obamacare that you like. Now, before you tell us which ones you like, make sure that they're really in the bill. Make sure they'll really do what you're saying they'll do. But I would like to hear what you like about Obamacare. The other piece is, when you do that, say, is there anything you don't like about Obamacare? If you like Obamacare and you think it should exist, are there any things about it you don't like that you'd like to see change? Let me know that as well. We'll respond either by email, or we may do another video if we get a lot of the same responses. Okay? But defunding Obamacare. Now, there's a lot of talk out there about defunding Obamacare means the Republicans will shut down Washington, that the U.S. government won't be able to function because the Republicans won't pass a continuing resolution to fund Obamacare. Well, that's hogwash. It doesn't even pass the smell test for a variety of reasons. The first issue that gets kind of ironic is ever since President Obama has been elected to office, he has yet to present a budget which has been passed. As a matter of fact, in the Senate, he has budgets that have been presented that the most they've been able to get is 2 votes. I'm assuming, I didn't really look into it, but I'm assuming Bernie Sanders is one of the 2, a self-described socialist. But he's one of the few, if not 2, that would vote for an Obama budget. Now, that's why we get continuing resolution. Congress's job, the president's job is to present a budget. Congress's job is to pass a budget. Not necessarily the president's, but a budget. The House of Representatives has passed several. The Senate, not so much. Because we don't have a budget, and because the American government is still functioning, they need what's called a continuing resolution. This allows the government to function without a budget. If the House of Representatives puts on their big boy and girl pants and votes in a continuing resolution that continues funding the U.S. government, but specifically prohibits any of the money to be used for Obamacare, they didn't shut down the government. They may have shut down Obamacare, but they didn't shut down the government. This is not a new strategy. Congresses have defunded unpopular issues in the past by passing legislation that funds the rest of government, but defunds these unpopular expenses. Now, will the Senate pass a similar continuing resolution? Who knows? Does Harry Reid have the courage to put a continuing resolution of any kind before the Senate? Maybe, probably not one like this. But put it up, vote on it, and see what happens. It doesn't shut down the government. The Senate, run by Democrats. The House, or the White House, may. But the Republican House of Representatives will not, because they will pass a bill that funds it. Now, we've also got the debt ceiling coming up. Another issue that is just synthetic government. Okay? We have a debt ceiling in this country that limits how much money the federal government can borrow. Every time, and by the way, it's coming up again this fall, every time the federal government runs up against its debt ceiling, there's an argument about if they don't increase the debt ceiling, the government will shut down, they'll default on their bills. No, they won't. They just can't borrow more money. They'll have to use all the tax money that they get from you, and they'll have to pay their bills, and they'll have to live within that. By the way, we are at historic low interest rates for the last about 8 years. Now, a lot of people say, well, that's a good time to borrow money. A lot of you have done that in your own budgets at home. Say, well, interest rates are low, I might as well go out and buy stuff with money I don't have. Actually, that's not a good financial move. The good financial move in low interest times is to refinance your debt and increase your payment on principal and eliminate your debt. That is what the U.S. government should have been doing during these times, rather than spending record amounts of money, borrowing record amounts of money, and increasing the debt ceiling every time they hit it. These are things a lot of people take a look at and say, well, I'm not really interested in politics. Shame on you. Politics directly affect you. You ought to be looking at your taxes every time they come out of your paycheck and wondering where that money's going. Is anybody being responsible for that? Instead of going, what can I get out of it? Say, where can we cut back? Because we are spending money that we don't have. We are setting ourselves up, we are setting our children up, and we are setting our grandchildren up. We cannot survive as a nation if we keep doing the things we've been doing. If we keep borrowing more money, if we keep spending more money. I get it, to those of you that are Republicans, that you're worried about the press painting you as the bad guy. The fact that they say you don't care doesn't mean you don't. Show people that you care, and the way to show them is by fixing these problems. I would say, don't defend it, defund it. If you disagree and you think that it ought to be defended, email me. Let me know which specific provisions you like. If you can, I'd appreciate you giving me the location in the bill where, or the law where that provision exists, so I can find it among the 20-some thousand pages. Write to your congressman, call your senator, write to the White House, go to protests that support your position in a non-violent and non-aggressive manner. Point out that this is not the way to fix our problems. It creates way more problems than it ever fixes. Give to your local charities. Volunteer your time. That's what a lot of us do. That is where we can make a difference. Wasting taxpayer money on a debacle like ObamaCare will not help. Now, what I hope you do is pass this on to your friends. Think about it. Study the bill. Pay attention. If you disagree with me, email me. Let me know which provisions you think we need and will help the situation in America. I hope that you will like us and share us on Facebook. I hope you will like us and subscribe to us on YouTube. I appreciate your time. I look forward to visiting again, and until next time, remember, it's not genetic engineering. It's third grade logic.